Gary Brooks with Orchestrating Health. I'm so pleased today to be talking to the former mayor of Fort Worth, Betsy Price. Betsy, how are you today?
I'm great. It's great to see you, Gary. It's great to be with you in Oklahoma City.
Well, we've talked on the phone a few times, and I tracked you down. I don't know if that's normal for people to just like try to stalk you, but in my research of who actually has moved a city from unhealthy to healthy, Fort Worth seemed to be the one that pops up at the top. I have said to people, and you correct me, is it the largest single city shift in like American history? What, 185th to 31st?
I
Talk
don't
about
I
that.
don't know about American history, but it's the largest city size-wise to ever make that kind of shift. Some smaller cities have made them, but we're now the 12th or 11th largest city. At the time we did this, we were the 14th largest city in the nation. And when we first started our Healthy Community, our Blue Zones initiative, they said, we can't do this. Fort Worth's too big. There's no way we can do this. And I said, yeah, we can. We're going to do this. Whether Blue Zones works with us or not, we're going to do it.
So what years were that? You were mayor for 10 years, is that right? Five
I
terms?
started in 2011 and I retired in 2021.
Okay, so you step in. Did you realize how unhealthy Fort Worth was at the time, or did you kind of recognize it once you got in to be the mayor?
It's a little bit of both. I've always been real active all my life, and I've always been involved in this community. I have three children and now three in laws and six grandchildren. And we've been active in church and scouts and junior league and business and all kinds of things. But my children are pretty spread out. And over the course of the time, from our oldest to our youngest, I watched and my kids were in public school. I watched the kids in school with them and really realized the kids are getting in worse and worse shape. And so are their parents. And it's not just weight wise. They spend too much time on the couch. They not enough time outside. Parents we all have all the conveniences we want that makes it easy. So I kind of watched that deterioration. I was Tarrant County's tax assessor for 10 years before I was mayor. And I had about 210 people working for me there. And I watched their overall health and whether they were at work or whether they were out when their children were sick, when they were sick themselves, and really realized the progression. People just weren't healthy. The medical care cost. And then I started talking to my friends in business, and they said, yeah, our biggest single cost behind payroll is healthcare. And
Wow.
it's astronomical. And the percentage of people needing it is astronomical. So when I went into the mayor's office, I knew that we, as a community, not only do I believe that public servants should engage people, you need to be out engaging them, involved in the community. And I never wanted to cram this down anybody's throat, but I thought we got to get out and get engaged. And what a better way to do that than to get out and get active? So we first started at Fitworth, and I knew that my friends that were teachers said, we got to get these kids in better shape. They go to sleep
Mm.
in class, they're not here, mother's sick or daddy's sick, or they're sick, and diabetes is just rampant among our children and pre-diabetes. And so it was kind of a full circle. We were seeing it at all points.
So you had been active your whole life, it sounds like, avid bike rider, and so you've kind of brought that mentality into the mayor's office.
Yeah, I pretty much did. And it was quite a shock for some of my staff. And the big city mayors all have a security detail. And my security detail, I remember I'd been in office about 6 weeks, and I said, guys, we're doing a 20-mile bike ride tomorrow, and we're inviting the public to join us, which means you'll have to go with me. And they were like, we're doing what? And we did a series of 5K runs, community runs to get people out, charity runs. The real shocker was I took office in June, and the following February was the Cowtown Half Marathon.
Mm.
And I always run one event at the Cowtown, run walk. Nowadays, I spend more time walking than running. But I said to my staff, some of y'all are going to have to do this. If we want this to be a good example to engage our community, some of you need to come with me. But they got used to it and they all got to where they liked it. They liked being out. We did walking town halls and rolling town halls and 5Ks. We did regular town halls, but we did all kinds of stuff to get people out and show them that you don't have to be. It's not about being thin. I'm not a skinny person by any means. It's about being fit and enjoying your life.
Yeah, and as you well know, and I appreciate you bringing it up, health is not necessarily a weight issue. Yes,
No,
we need to exercise. That's part of it, but
yeah,
it's mental health. It's just overall hope and purpose and well-being
yeah.
and
When I
stress, reducing
Yeah.
stress. There's
I
so
knew
much
for a
involved.
fact that I couldn't do that job as mayor. It's 14 to 16-hour days, 5 days a week, generally a half day on Saturday, and I tried not to do Sunday work, but you have some. And I couldn't do it without getting my stress relief and getting out in the sunshine or just getting out and stressing your body a little bit is a tremendous stress reliever. I couldn't have raised 3 children and owned a business. My husband had a business, been a big community volunteer without staying active. It's what's kept me going.
So how do you build that foundation and make sure people aren't thinking this is just about a weight loss program because it's not? What things do you focus on and get people to focus on so that doesn't become the issue?
Well, we started out with our schools. We started a program called Fit Worth
Mm.
in combination with UNT Health Science Center and Fort Worth ISD, and then we gradually added in some of the other schools. Because if you can get people's kids engaged, you can get them engaged more often than not. And we would go and we had contests, their PE teachers ran it, and they had contests for prizes and they had cooking classes for them. So many of these kids go home alone. They're latchkey kids, and they need to figure out, shouldn't just go grab the least healthy. So they had classes to teach them to cook healthy snacks. But the kids got real engaged in some of the running clubs. We had running clubs, and I would go run with them, and some of my staff would go, and they liked to compete. They wanted to see if their school, and part of it was a family challenge. We did these running clubs, and they had a chart they had to fill out, but they had to get a parent to agree to help them with it. And I remember we'd been doing it about 6 months, and I ran into a girl at the grocery store, and she said, "I don't know whether to hate you or love you." I said, "What are you talking about?" She
Yeah.
said, "My son came home 4 months ago with his running challenge from his school that said Mayor Price's Healthy Challenge, and it's a running club." She said, "And he said, his daddy or I have to commit to help him 3 days a week, 20 minutes a day at minimum." And she
Wow.
said, "So here I am with 2 kids and homework to do and business to do, and I'm trying to cook dinner." And he's going, "Mom, come on, we got to go outside and take a walk. The mayor says we have to take a walk." And so she said, "We got to where we walked every afternoon, and then the weekends we'd ride our bikes, the whole family." And she said, "It's very rewarding." And she said, "At first it was very frustrating, but the kids were adamant about it." And then she told me a story that really moved my heart. She said, after we'd been going for a couple of weeks, we got to looking at one of the houses down the street from us where there's an elderly couple lives, and they hadn't picked their paper up for a week.
Hmm.
She said, "I finally went up and knocked on their door and said, 'You're not picking your paper up. Do you guys need help?' And she said, 'We live alone. We have no one. And my husband's been sick and I can't even pick up the paper.'" And so
Wow.
they formed a neighborhood group. It's really about building neighborhoods and building communities. And, as we added more sidewalks, more streetlights, more people told me they didn't feel safe in their neighborhood. So our built environment went to adding sidewalks and streetlights to try to increase the safety, more patrols in the evening, and encouraging them to be out. You'd be amazed what it does for a neighborhood.
Well, let's talk about that just a little bit. Our cities and our council has done a real good job over the last few years of building more sidewalks and more trails.
Yep. And
But the
trails.
more I research this, I've kind of going to them privately and saying, we need more. Like, we're doing it. Go, no, we need more. You can't have enough of this kind of thing. Better parks, more streets, more lights, more trails. So, how much did you add? Was that something that you just kind of said we're going to have to do constantly and just make that part of our culture?
Yeah, I'll start first with sidewalks and start first with streetlights. we would do
Mm.
these events in neighborhoods, and people would say, "But we can't go out at night. Our streetlights are out." And I would go, "Have you reported them?" And they'd go, "No, we thought the city would find out they were out." I said, "No, the city doesn't have the patrols to know every street. You got to report them." So we developed a new program, our Traffic and Public Works, to try to track streetlights and replacing more neighborhood streetlights. Then we began to add sidewalks, and we worked with our builders associations, said, "What can you do to make certain that you're getting sidewalks in?" They said, "Well, you guys changed some of and trails. We changed some of our built environment code things that required them to help us put in for every open space and green space to put in trails, expand those trails." It wasn't a burden on the builders. We never wanted to burden them. It made their homes more attractive. And then we worked with our schools. You'd be amazed the number of schools who said, "We got this great playground and it's fenced on all four sides. It's only available to the community. It's not available to the
Mm.
community. It's only available to the kids during school." So we went to the school boards and said, "Would you consider opening your playgrounds in the evening for an hour or two after school? And would you open your playgrounds on Saturday?" And they began to look at it and said, "It makes perfect sense. Get our neighborhood kids back in the neighborhood, get their parents out there, on our tracks." And we even had a couple of schools who said, "Your school's landlocked. The kids have to come all the way around this subdivision to the front of the school to get out because you fenced all the school property. There's no cut through for the kids to walk or ride their bike from their neighborhood." They went back and said, "You're right. We've
Wow.
just made this school a barrier, which really takes the burdens off of these kids being able to walk to school or ride their bike to school." They went back and took out part of their fence. That happened in two or three schools that I'm aware of. And the kids, we started encouraging the kids, "Okay, your school's open now. Walk with your parent or do walking school buses." And we did lots of walking school buses. We had started one part of a subdivision, and kids would know we were coming along and they'd join us and walk to school.
Mm.
Some of those walking school buses are still going on, and so are some of our bike buses, where we say, "We'll pick up your kid on their bikes on the corner." There's one that's every Friday now in my neighborhood. There's 50, 60 kids ride their bike in and join and ride into school.
That's great. Let's stay on kids a minute because I you focused on that a lot more than I had in my initiative. I'm
And
not
it goes back, Gary. One reason to focus on kids is because you've got to get this next generation started.
right.
But if the kids want to do it, their parents will come along too.
Great point. I'm not very many years younger than you, but
Well, probably more than you think.
when we were in school, diabetes, this I can't think of one kid in my second grade class that would have had diabetes. And the kind of things that we used to do in the gym, climbing ropes and d- I tell people this stuff is not hereditary. We have created this environment for our children. So I'm assuming you got a little bit of pushback from parents. How did you deal with that? How did you get the schools and the everybody to come along with that? That's a massive reach.
Well, we engaged our business community first, big business, and tried to get them involved, to get the school boards involved in it. And parents, one of our big employers, I'll give you an example, is Lockheed. Lockheed
Right.
employs, at any given moment, they'll have from 25,000 to 45,000 employees in the city. And Lockheed said, "We can work with you on your fit worth. We can give these folks, we can figure out a walking path for them, and we can give them incentives to get them walking because we're drowning in healthcare cost. And we can if they can get their kids walking and they come in and say, 'My kids walk too,' we'll send some incentives for the kids." So it just kind of was a domino effect. You'd be surprised if you're not saying you have to do this, and you're not saying this is about weight. If you're saying this is about our community, this is about meeting your neighbors, this is about getting up from your cubicle at work, taking a 10-minute walk or a 15-minute walk, taking the stairwell, the staircase instead of the elevator. Simple, simple things. It's about businesses saying to them, I'll give you an extra 10 minutes a day if you want to go out and walk this walking path. People will get engaged. I ran into people who said, I didn't have any interest in doing this, but you came out and my boss said, the mayor's coming. Everybody in our department's going to go out and walk with her for at least 15 minutes. And this one kid got started, young man, he was a severe diabetic. He was in his late 20s. He emailed me later, about 6 months later, and said, very overweight. He said, I was on 18 medications when
Oh,
you
wow.
came out and started walking with us. He said, I'm down to 2 medications now and I've lost 90 pounds. He said, I will walk the rest of my life and my children will walk. And he said, the cool thing is, I'm going home at night and my kids are putting their electronic devices down. And I'm saying, let's go take the dog for a walk. Let's shoot some basketball hoops. And he said, I found out things about my children that I didn't know about them.
That's the story we've got to have. We
Yeah,
need
that's the story.
thousands of those kind of stories.
And whether
So
you're talking about health and wellness, you're talking about engaging a community and a community that's not just an isolated big city anywhere.
you had tremendous success in getting your businesses, particularly some of your larger ones, your largest medical provider, Bell Helicopters. I look at some of my business friends and all of them will listen to me, but most of them just kind of look at me and their eyes glaze over like, Gary, crazy. We're not thinking about that. How do you engage your business leaders to understand what this is really costing not only them, but our city?
Well, have you guys done a survey of your city? To do this effort, it really needs to be data driven. The first thing we
Great.
started with was the chamber and Texas Health Resources, our large health provider, and the city did a Gallup well-being. Gallup does a well-being of all the major cities by themselves anyway. And you can get a copy, you can participate and get the copy. And when we first got our first one and realized we were 185 out of 191, I think it was, or right there in poor health, the chamber said, you can't put this out there, Mayor. It'll shock businesses and they'll want to move. But the business community didn't have that reaction. The business community said, maybe we need to take a hard look at where our dollars are going into absenteeism, into medication, into lost productivity. They just got they got interested in it. You need a champion in the business community. You need a champion in government, whether it's at the city or the county. You need somebody at the schools that'll help you too. And it's got to be data driven. You've got to be able to go to them and say, "This is where we are, and we can't go on with this kind. We won't have a healthy enough workforce to furnish you the workers you need. We won't have well-educated students if we don't make some drastic changes here."
I got to ask you, was some of this just this Texas people going, we're not going to stand for being last. That's what happened to me. I was just sitting in my chair at home. I didn't know the statistics and I'm looking at them and I thought, if I walked in to 100 of my friends that own businesses and says, hey, guess what? We're going to be last in health in the country and it's going to be okay. We're just all going to accept it. I thought we would never do this. We're
No,
better than this. Was there some of that down in Texas?
there was some of that, of course, it's Texas. I mean,
Yeah.
what do you expect? There was some of that, but there was an awful lot more realization that their bottom line, their long-term productivity for the chamber, their ability to recruit new businesses, to recruit new families. People wanna be where a community's engaged, where there are outside options. The home builders, the realtors all got into it because they realized housing additions that have the ability for people to be out sell better. They attract more people. It just I mean, we spent a long time in this country not getting people out, building conveniences. And now the real businesses and the realtors and everybody realize families are beginning to say, we want to be somewhere where there's a focus where I can get healthy foods, where I can get out on my bicycle, where I can walk with my children, where there's open space for us to play, where there's adequate parks. Particularly after COVID, that's become a huge draw That's a great selling tool for Oklahoma, is to say, here's the data on where we are, folks. Here's the projection on where we will be. But here's what we can do to change that trajectory.
Yeah. We're business people, so
Yeah,
data is critical.
data is critical.
So
It really is. And you know, you got to have strong community support. The other piece that we did that Blue Zones had never done before, I had a faith-based cabinet made up of the ministers from all the mainstream religions, the evangelicals, the rabbi was there, the bishop was there, the imam from the uh, Muslim church came. And I met with them every month or 6 weeks just to talk about community issues. And we started talking about this, and they said, one of them, I'll never forget it, the first meeting said, we focus on people's salvation, but we ought to focus on on the temple that they live in, the temple that God
amen.
gave
Yeah.
them to live in. And he said, we've never done that. And many of them signed on and started what Blue Zones calls MOIs, which is community workshops and a community you can connect with. They just started small groups at their churches, and they had people walking. They had grew gardens. They had kids programs for gardening, and it was a huge movement because in America, the average family is churched one way or another or has some type of faith more often than not. And it's a great ability to, when you can get your religious leaders behind you, that's a great way to drive a community too.
Great point. Well, I've heard Dan Buettner, founder of Blue Zones, many times talk about how either he didn't call it necessarily a spiritual component, but a faith-based component in
Faith-based
these cities
component.
is very important. So
Yeah.
I'm assuming that he just came along with that, understanding that was an important uh, footnote or an important strategy of these blue zones.
Yeah, he knew that in the 9 communities that they designated blue zones when they started their study, that faith was a big piece of what kept people going. But in the communities they added since, the smaller communities, they had not really focused on the churches. And they had just focused on people developing community and finding a faith they could connect with. But we said, let's make them partners. Let's make them part of our advocacy group. And he said, okay, let's do that. I mean, there were lots of things. You have to make this, whatever you do for your healthy community, you have to make it custom fitted for your community.
Right, right.
One of our first disagreements with them was they wanted to rubber stamp, wanted us to follow their exact pattern. We said it won't work in Fort Worth. I mean, Texas is beef country, particularly where we just had our stock show and rodeo. And I said, you're kidding me. You're going to ask me to ask these restaurants and to give up meat or to hide it down their menu? I said, no.
Won't
So
happen here.
what we can do is suggest to people, if you're used to having steak 5 days a week or 6 days a week or hamburger, or something like that, how about thinking about having it one less day a week or 2 less days a week and adding in fish and adding in beans or adding in, and most people didn't think that was a burden. And the restaurants on the whole said, we've got healthy choices on the menu. We can push those too. We can make them a little more prominent, or we can make the side. And one big thing they did was, and now the restaurants love it. It really came into being with COVID too, but we had started it here. Bread and butter on the table adds lots of extra fat that you don't need.
Especially when you eat it first.
Yes, and we got lots of our bigger restaurants to say, okay, we won't put it on the table. We will ask people if they want it, but we won't put it on the table. And I remember the Capitol Grill owner called me, or manager, and said, we've been doing this 30 days. And she said, 50% of our people turned down the bread and butter. She said, you would be amazed at how much money I've saved. He said, and we would have put it on the table and they would have eaten it, and we would have had it wasted.
I appreciate you speaking to our restaurateurs, because I've eaten at a lot of restaurants in Fort Worth, and you may know we have some incredible food and beverage folks here in
You
Oklahoma
do in Oklahoma City.
and getting them on board with this somehow, I think would be an important part of the strategy. So I appreciate that you're sharing some ideas that were embraced by that
Yeah,
community.
they didn't all get involved, but all of them said, we will think about what we can do to begin to at least offer an option somewhere.
My wife and I were out in California, and the restaurant offered half portion of desserts.
Yeah, which
Save
I
a
would
couple
love.
bucks and only got half. They would actually offer that as an option. And I thought,
Yeah,
how easy is that?
yeah, it's simple.
So let's talk about you're the mayor, you start this initiative, people are getting on board. Did you bring in staff people like city staffers that actually focused on this?
We actually did a 501(c)(3) to manage the Blue Zones project, and the hospital district, kinda helped us get that underwritten so that the city doesn't have enough extra staff. We don't have the finances to do this. I did have some of my staff helping with it. The chamber had some staff, but we ultimately raised enough money that we hired a Blue Zones project manager, and we started with a girl, and then she got a nice advancement. We ended up with a guy. And so he ultimately hired people under him to do advertising, to do communications, to coordinate the calendar, to work with the restaurants, to work with the businesses, to help coordinate the school program. We had, I don't know how many full time people, but at peak we had 15 or 16 people, probably 6 or 8 working full time, another 6 or 8 who were part time. But in a city the size of Fort Worth, it's a big effort. It will be in Oklahoma City too.
But
And
privately raised funds.
yeah, we raised funds. This community's philanthropic community was very generous. They could see the benefit of this. The big businesses could see the benefit. Not everybody we went to gave. A lot of people said, "No, I'm not. I think you're way off base here, Mayor. I don't think you can move the needle." But that's okay. Enough of them did see that we could do this, and did have faith in the partnership between the hospitals and the uh, chamber and the count and the city's office, the mayor's office, that they said, "Yeah, we can help you with that. What could be bad about us donating to a project like that?"
Well, you moved the needle from 185 to 31st
We did.
in 6 years or 7 years.
About 6.5 years.
How long was it before you really looked at your staff or your husband and said, okay, we got momentum. This is actually going to work?
It was probably, I'd love to say it was a year, but it was really before I felt really, really confident. In a year, I could see that we had momentum to really engage people. But were they really following through and doing things? But in 2 years, we could really begin to see the difference. More and more people showed up when we said, posted a couple of times, 3 or 4 times a month, we would post, "We're going to this park. Come join us. Let's take a walk." Or, "Today's a rolling town hall. Get your bicycle out and come join us." And when the crowds began to grow and people began to show up, and then we started hearing anecdotal tales from some of our bigger employers, I thought, okay, and people started saying, "I feel better. I sleep better. My
Mm.
children are in school more often. They're more focused on their homework." Probably seriously started hearing those tales about 18 months to 24 months. I thought, we can make a difference here. We can really move it. And the second Gallup well-being study that we did was 2 years in, and it showed a fairly significant shift then.
So in 2 years, you went from 185th to maybe well, do you remember what that number was?
Yeah, I've got it somewhere. We went, but we dropped dramatically. We dropped to like 104 or something like
And I'm
that.
sure you made that well known
Well known,
city.
well known. And the cool thing about the project was, as the city's well-being got better, the nation as a whole's well-being was not getting better.
Right.
It was getting worse. And we were able to say, "Okay, folks, here's what we are doing in Fort Worth, and here's where our numbers are." And nationwide, they're now much worse than we are, either up or down, depending on which way you want to look at it. And then through COVID, we were able to hold our numbers and keep our overall numbers much better than the nation, which took a big nosedive, not just COVID related, but overall health related, according to Gallup.
And not only are people feeling better, now there's some civic pride that's
Yeah,
coming
yeah,
in.
yeah.
Hey, we can do this. Let's see how far we can go.
And they're more engaged. There are more people now who know their city council people, know their school board members than there used to be. There are more people going out in their neighborhoods in the evening than I've ever seen.
Hmm.
It's amazing to me. And sometimes they're out, 10 minutes, and sometimes they're out walking or visiting with their neighbors and pushing a grandchild on a tricycle for a good long while.
So you left office in 21 or 22?
21,
21.
summer of
So
21.
it's now going on 5 years. You obviously continue to see that momentum. It hadn't decreased much, or if
Oh,
any.
in certain places, there's probably been some fall off, but in other places, there's continued to be a gain. We tried particularly the Blue Zones licensing that we had. We paid them and used it for till about a year and a half ago. And then we said, we're not going to pay again to use the Blue Zone label. We will just stick with Fitworth, Healthy Community, and Healthy Community Initiative through THR, through our health people. They run the program now. And they really have, after COVID, they really had an even stronger focus on getting healthy food, particularly in our lower income communities. And they said there's a little drop off in some of these areas, but not significant. They haven't done another Gallup well-being study. They've got a new one that they haven't released yet, but the initial analysis, they have done one, they just haven't released it to the community. The initial analysis on it looks like we're holding steady.
Well, having a program that touches everyone, that allows everyone to participate, is vitally important in our strategic plan.
I agree.
So what kind of strategies did you put in? You used a term with me on a phone call, gentle nudges. That
Yeah,
I
this isn't
like
about,
that term.
I'm a conservative and I believe government is there to listen to your needs and to facilitate what you need, not never to tell you what you should do. So we use gentle nudges to try to change them. You make the sidewalks more available. You make trails more available. You make fun programs at the kids' school that will spill over that require parent participation. You get your businesses to agree to give people a little extra time if they're doing this and that. And, you try to get your medical community to say to their patients, the medical community is a different beast, but some of them are really beginning to talk more about the fact that movement and faith and being engaged with someone is what's so critical to longevity. So you just kind of have to keep pushing, not pushing it down anybody's throat, never, but making it available to them, because then it's just a gentle nudge that we change, that you can change.
Well, I wrote down a lot of things from our first conversation, and one of them I thought was fascinating. Just, I think it'd fall under this gentle nudge. I think I asked you about, did you get the Coke machines and in these schools? And I think you described a way of putting some healthier stuff in the middle, and you got the vendors to agree to this. Walk us through that, because I thought it was fascinating.
Yeah, vending machines are the bane of the schools, but some of them nowadays have bans on them, but 6 years ago or 8 years ago, they really didn't, and they at City Hall, they drove me crazy because there's nothing worthwhile in those vending machines, but people go to them constantly. So we sat down and said, "Let's figure out what we can do here." Coca-Cola has their largest distributorship in the Southwest is here in Fort Worth. We sat down with their guys. We sat down with some of the others and said, "Would you consider putting water and Powerade and other healthy things in the center of the vending machine? Put your soft drinks and the snacks lower down." And most of them said, "We can do that."
Hmm.
And they were amazed at how much better some of those products sold. I mean, one of the behind the scenes Coke guy said, "It doesn't matter to me." He said, "I get paid on what that vending machine produces, And he said, I really don't care whether you're selling Cokes or water. My profit's the same on both. And he said, and I'm shocked at how much better people are making their choices. They're still getting their sodas, they're still getting their snacks, but they're just, the option is there. And we had that experience with the schools. My young leaders group, which is a young group called Steer Fort Worth, took on a project to change school lunch lines because they went to the schools and said, these kids, the first thing they offer them is what they call pink milk, which is strawberry milk.
Oh,
That's literally, I've forgotten how many grams of sugar it is now. It's much worse than chocolate or white milk, either one. It's the first item these kids see in their lunch line. And for the younger children at eye level, pizza, corny dogs, hot dogs.
right.
Fresh fruit is up on the top shelf above the younger kids. And other simple goods are either below or up this top shelf, and the kids just get them. But the other thing, and so they got the school district to agree to move the sweet milks to the end, to put the fresh fruits at the end and down low, and change a little bit of the layout. And it worked pretty well. The feds came in and said it doesn't fit our FDA guidelines, and so for funding, so we kind of still have a battle going on with them. The other thing they did do that the schools have stuck with, this group of young kids said, we watch these kids. They come out of their morning classes and they want to see their friends. And so they have recess right after lunch. So they hurry through lunch and they throw most of it away to get out to the playground. So they asked 6 or 8 of the principals said, would you consider shifting this around and giving them recess first and lunch after?
Hmm.
They discovered the kids ate 50 to 60% more of their foods, and their good foods, if they had their lunch after their recess. Some of the schools have stuck with that.
Well, I bet you have a lot of these things that you could teach us.
There's a
So,
lot I could talk. I'll talk too much. I'll probably talk too much anyway, Gary.
no, not at all. It's fascinating. I knew the first time I talked with you, I said, I've got to get you in front of my city.
Well, thank you. But,
Back to,
really, people need to realize this is about, it's not about weight. It's not about, it is about engagement, but it's not, it's about putting more life in your years. I'm 76 years old and I want to be here to play with my grandchildren. I might keel over tomorrow, but I'll go out healthy doing it. I want to be able to pick my grandkids up. I want to be able to ride my bike. I want to be able to shoot my shotgun and do what I want to do. And my husband's the same way.
what we call health span, that last
Yep.
decade.
Yep.
Live long, die fast, as
That's
a
right.
term I
Fall
heard
off the cliff.
once. So back to business and data. I've seen some statistics in my research, and I'm just wondering how hard this is to really quantify of the reduction in healthcare costs, the increase in productivity. How did you manage that? How do you measure that? And how do you help your businesses understand what this really costing them?
It's a little harder to do that. You've got your HR departments in the businesses have to be willing to spend a little extra time studying that. Some of them did, some of them didn't, but all of them will tell you anecdotally that they could see a shift in it. DFW Airport, who's one of our largest employers, track theirs. They came in late. We'd been going on Blue Zones a year and a half before they agreed to join. And in 2 years, Sean Donahue, who was the CEO then, brought to his board, and I happened to be on the board at the time, a reduction in their healthcare cost, a reduction in the number of people taking multiple. I mean, he had it broken out from people that were taking 20 medications to moved it to 10, to those who were taking 6 or 8 who had moved it down to 1 or 2. It was staggering. I couldn't find my numbers this morning, but the reduction that they saw, and they quantified it because they wanted to see, was phenomenal.
Hmm.
And he said, my supervisors will all tell you that the attitude of their employees is much better too.
Well, I've heard you talk about the how economic development is absolutely impacted by the
Oh,
health of
absolutely.
communities.
Absolutely. Businesses are they ask you clearly when they come to see the mayor or the chamber, to talk about relocating to your city. You know this as a businessman. The first thing they ask you is, what kind of tax incentive break will you give me?
Right, right.
Tell me about your workforce. And surprisingly, their third or fourth question will be, tell me about the health of our workforce. Will they be here? Are their kids well educated? Are they in school? Just interesting. I would have never guessed that it would be that high up on their radar, but it's pretty high up on most of them's radar.
And you were able to put that data, hard data, right in front of them from Gallup, which I've seen numbers into the billions of dollars to capital investment that were brought in under your tenure.
Yeah, yeah. We grew from, I took office in 2011. We were the 17th largest. And when I left in 2021, we were the 12th largest.
So
We went a little better than 800,000 to pushing a million.
when that question comes up with companies looking to move, I imagine cities that are on the bottom kind of want to divert away. You probably just grabbed it and really used that as a primary recruiting tool.
Yeah, a lot of them just say, "Oh, you ask that question in most cities," and they're just like, "It really doesn't matter. Our community's gonna have everything you need in the way of workforce and the way of health." And we could actually say to them, "Here's what we're doing, and here's what we see. Here's why the quality of life is better here." They
So
won't have employees. They wanna come into a community where their employees are gonna be content.
the data, I think if I get my numbers right, showed that the lowest income areas of Fort Worth actually had the highest or some of the highest improvement in health, like 10,
Yeah, they
11,
did.
12%.
Yeah, we had one
Unpack that a
community.
little bit. That obviously had to be a focus.
It was a strong focus. We broke this city because it's so big into 4 quadrants. No, we did 5. I take that back, into 5 areas. And when we first started, the agreement was we will do one community that we feel like is already a little focused on their health, understands it, that has pretty good access to trails and things, and then we'll do one of our underserved communities where the health is really an issue. We have an area 76104 zip code, which has the highest mortality of any major zip code in this. It did have, it's not so much now. Um, and shorter lifespan than any other areas in our city. And we took it in, we saw a 10.45% increase in their areas in the time
Wow.
we worked on this. It was amazing. But the fun thing was we moved that around into, and then the next one was one of the lower income areas, um, where education levels are low, but we knew they were interested, and we really pushed engagement there, and we really pushed the built environment. They didn't have good grocery stores, and we can't force a grocery store in, but there were lots of dollar stores there and Dollar General and that type stores. So as we were permitting new ones, we said, you need to offer more fresh fruits and vegetables. We would like for you to get this permit to agree to have these products in your store." Most of them did. It wasn't an issue for them. And it made it a little easier. We did some sidewalk vendors for fresh produce carts. We had some vendors who said, I'm pushing an ice cream cart through this neighborhood. I could also push something that sells Gatorade, Powerade, oranges, apples, just, peanuts, a little healthier thing. They did pretty well. They didn't do as well in the summer when it got up to 100 degrees, um, but, just some changes. The city's part in this is to make changes, simple nudges and changes in your built environment. Make certain that you got sidewalks, make certain that you got lights, make certain that you got access to your trails. We enlarged our trails network dramatically, but we had to figure out, how do we get all these neighborhoods to be where they can access those trails.
So did you find that doing some of those nudges would get the leaders from those different communities more engaged? Was that
Yeah,
easy or hard?
I'll give you one example, a little bit to what you're saying, a little bit not. We had a big group in the community who had always wanted for it to be a no smoking community. No smoking in restaurants, and nowadays that's every city has that.
Right.
But 10, 15 years ago they didn't. There were limited bans, and I said, we're not going to tackle that. That's a independent issue. Restaurants can ban them. Nothing says they can't, but we're not going to tackle that until we get an outcry from the public that they wanted it done. So the medical community came together and said, we're going to start promoting this through your blue zones, through your rolling town halls. And I said, you find you get people to show up at City Hall with enough numbers and enough data, we'll talk about banning it in city buildings and schools. Schools had already banned it, I believe, but just a more comprehensive. So we became a smoke-free community. You can smoke so you have to be so far from buildings, so far from restaurants, certain distance from playgrounds and schools. And it wasn't driven by council or the mayor. It was driven by the community.
which is ultimately what it has to be foundationally built on. The community's got to make the change.
They will never stick with it if it's driven down their throat, but it's got to come up from the bottom.
So if you're talking to one of my business owner friends, executives sitting here going, all right, Mayor Price, that's a nice story, but I'm not sure it works for us. What do you say to us?
Well, I think what you have to ask your business communities is, what are you seeing among your cost for healthcare, productivity, absenteeism? What is it that you think you could get your employees to do or your business to do that would help? We're not here to give you a one size fits all, but what is it you could do? I mean, here's some ideas that we've had. Some of them will fit your business, some of them won't. I think they need to understand this is about health span. This is about not even just about longevity, but it's about more quality years and life in your years, not more years necessarily. But I think they have to understand they've got a piece in making their employees' lives better too. What is it they could do to impact that?
I have not asked you this question, but it triggered me. I've heard before that the healthier community, the bigger the voter turnout. Have you ever heard
Yeah,
any connection to
I've
this?
heard that too. We didn't see that.
Okay.
We suffer like all the major cities with low voter turnout, but I don't know why.
All
I
right.
think
I
that
didn't
is
know if I heard that from somebody
no.
who they were talking about or not. So
People talk about it all the time, but it certainly wasn't anything we've been able to measure.
I think back when you were mayor, Mick Cornett was our
Yeah.
mayor,
Yeah, I know
extremely
that well.
popular.
Yep.
Uh, Mayor Holt was just reelected this week at nearly an 86%
Awesome.
number.
Awesome.
So putting him on the spot, if Mayor Holt called you and said, okay, Betsy, where do I start? What would you tell him uh, as our leader in our city and extremely popular and just a great voice for our city? And to his credit, he's really has gotten engaged
Good.
with my crazy idea. You gave
That's crazy.
credibility to it when he said, well, hey, why don't you try to get a hold of Mayor Price and see if she can't help us? So what would you say to Mayor Holt?
First, he's got to be passionate about it. He's got to be willing to be the champion. People want the people they know, and that's generally their elected officials to be the face and be the champion. Second, he needs to get the data. He needs to really survey either a Gallup survey or somebody else's surveys, your community, so that he can say, here's where we really stand, folks. He needs to talk to his business communities. He needs to talk to his education leaders. You've got to build that coalition and you've got to figure out what it is that you want for your community and that you're not really what you want. You've got to figure out what it is that your community wants. What will they connect with? But it's you've got to have a champion who's got a passion.
So you've given us a lot of reasons why it worked, things that you did. Was there a mistake or two that you look back and made that you can help us? So you'll save us 3 or 4 years just in the things that you'll teach us. So what are a couple mistakes that you think you made that you would tell us to be careful?
There were numerous small mistakes along the way. Nothing really major comes to mind. I think it you when we first started, we did not engage our local networks and our newspaper and stuff. And it became real apparent that if we were really going to impact the city, we had to get our communication people at the table. And we were able to get Channel 5, which is the NBC affiliate here, to be our champion for it. And then the Star Telegram too. Not getting them on the project at the very first cost us a little bit of time, because had we had them, we could have pushed this even further, because they're the ones who talked about it on the news, showed the town hall, showed the walking at Lockheed, just, and people would go, "What were you doing there? What were y'all working about?" Or, they would go to the churches and visit, and they just helped us the Trinity Metro, our public transit, wrapped a bunch of their buses with blues on, said, "Find out how, you could park that car and use the bus and walk." Those were kind of fun wins. Right off the top of my head, I'm sorry to say I can't think. I probably put a
Good.
bunch of mistakes in the back of my mind.
Well, as you think of them, you call me and
Well,
we'll
and the other
out 'em.
one is hire a champion. Hire somebody. You've got to have a champion a face of it. And that could be Mayor Holt, it could be some other leading citizen in your community. And then hire somebody who's really passionate about it as your CEO to run the project. Somebody who's thinking about the impact on your community 24/7.
So Fort Worth just opened the Betsy Price Community Center. Congratulations. What's that facility look like? What's
It's a
involved?
beautiful new facility. It's clearly got a big gym. It's got rec rooms. It's got a tremendous demonstration kitchen in it where people can come, and the Parks and Recs offer cooking classes, or the community can come in and offer cooking classes. There's after school childcare there, before and after school childcare there, and it's surrounded by a little over a mile walking trail that people can walk or ride their bikes on. It's pretty much a just open door facility. And I was out there. Cowtown Marathon, our big marathon, has a program called CAF, which is Children's Activity for Lifetime Fitness. And we do running clubs and get the kids to do these 5Ks that are part of the Cowtown. And we give the kids who need it new shoes. And I was there last week for a shoe fitting among some of their children that are there and that are going to run Cowtown in 2 weeks. And they were having more fun, and the community was so pumped about it. And the manager said, "The only drawback to this facility," and I thought, okay, here it comes. There's some problem. He said, "We didn't build it big enough."
Uh,
And
Great
I thought
problem to
that's
have.
a good drawback to have.
Well, Mayor Price, I'm so grateful that you've been willing to be open to have conversations with me. Uh, you're a credible voice. You've done it, and you're able to stand up and go, "Hey, this is possible for a city bigger than ours." I call this a city initiative. It's really a metropolitan area. I think of Oklahoma City as 1.5 million people uh, all across the metropolitan.
Yeah, Fort Worth's, a
And my
2.5 million.
my hope is that we expand this to our state. That's why we call it a healthy city initiative, not a healthy Oklahoma City initiative. So that's our goal. So I'm just really thankful that you're willing to bring your expertise and your support to help us champion this. So you've been very generous and kind, not only with your time, but just your knowledge. And so my city thanks you in advance because uh, we're going to do this.
You're gonna do this. You've
Yeah,
got
I've
the
talked to
passion.
enough people, and while most people, their eyes are kind of glazing over, we're going to do this. I believe you set the standard, you set the model, and it's something that we're going to be able to follow. So
Well,
in
I
preparation.
truly believe the nation as a whole has to do this. We can't go on being unhealthy. The cost is too high. The cost in human capital is too high. Just too many people. We shouldn't be where we are, and we as a nation. And it behooves those of us at city leadership to start it. And you're a prime example, Gary.
Well, our summit is March 9th and 10th. Healthycityinitiative.com. People can sign up. I would be incredibly honored if you could figure out how you and Tom could make a trip up here and sit in the room of that conference and just give us some wisdom. And sometimes having the expert in the room is exactly what we need. So
When
if
you
that
have
works out.
tremendous speakers. People ought to go and hear. Some of those speakers will inspire them to do things they hadn't even thought that they wanted to do.
Well,
I'd
thank you for
love to
saying
be
that.
there. I'll try to be there.
Yeah, we have put together quite an incredible range of
You
speakers
have.
from
I'm
all over the country,
impressed.
Oklahoma Medical Research Foundation. So, well, again, I'm just so thankful for your time. We're honored to have you on here today, and just bless you, bless what you've done for your city, and we're thankful.
Bless y'all. Keep pushing. It's the right thing to do.
All right, have a great day, everyone.